Hello, welcome to episode 13. I'm having coffee this morning with Dave and Jasper. Jasper's just drunk most of the coffee in that cup.
Nearly all gone.
Now, what I wanted to mention to you this morning is one of my favourite movies, and one of my favourite movies is actually The King's Speech.
Mine too.
Absolutely incredible movie. If you haven't seen it, make sure you do have a look at it. It's just incredible. Fortunately, treatment for stuttering has changed significantly since the King's Speech and since King George VI. And fortunately, we can now have access to treatments even if you're not the king. Back then, you really had to be the king in order to, or soon to be the king, in order to access people with expertise.
It seemed that way.
It did seem that way.
Now, I'm just going to talk about Ezy-Speech and why it was developed, but I'll just put Jasper away so we can concentrate on that.
Bye, Jasper. See ya.
So, interventions for stuttering are available to everyone now and not just King George VI. Just a bit of background on Ezy-Speech and why it was developed. Originally, myself and another recovering stutterer, Ray Potter, we've been involved with the Speak Ezy organisation in Queensland for many, many years. Ray well over 30 years and I'm approaching that. And our role within the Speak Ezy organisation, well firstly, the Speak Ezy organisation is for recovering stutterers who have had treatment in prolonged or smooth speech. So our role within that is as group coordinators, where we see a lot of stutterers and we run booster programs and our annual camps. We're only dealing with a small number of people in terms of the number of stutterers out there. So we thought, well, how can we put together some sort of program that will help a lot more people? And we thought of the medium of the internet and TV, and we thought of maybe put together a program on DVD so that people can actually take that program into their own homes and get good quality therapy with state-of-the-art cognitive ideas. So as well as 2 recovering stutterers developing this program, we also brought in the power as Dr. Lisa Hudson and Judy Rafferty, our psychologist. It was important to have the backing of clinical experts to ensure that the Ezy-Speech program was a functioning, well put together program that we're very, very proud of now.
The motivation, I think, for Judy and I was that over the years, I've certainly had the experience many times of people coming into the clinic, doing their therapy in the clinic, doing very well at learning technique in the clinic, but then being challenged when they need to transition out of the clinical environment, and also being challenged to attend enough appointments to really consolidate their level of fluency. Right. Time and money is an issue for a lot of people. To keep going back for appointments when you're working full time is really difficult to do. And for a lot of people, I think they would get to a certain point where they were doing very well and they were feeling pretty good, and so they would stop, but it really wasn't quite enough just yet. And then for a lot of people, they were nowhere near a Speak Ezy network.
The distance
so they just couldn't then have the support in an ongoing way. There was nobody available to them after they'd finished their therapy that they could keep going.
And the beauty of it is that the program's always there for life. So when you feel like a booster, or even the daily mini booster, which we've also talked about before, but also just doing a refresher program. You might be feeling a little bit down in terms of fluency at this particular period of your life. So it's just easy to put the DVD in your machine and do the program all over again. It's wonderful, invigorating, and gives you that feeling of control that we, as stutterers who have had therapy, know all about.
It does. It gives you that cue. And before we rolled the camera, we were talking about having a cue that then triggers a routine that gives you an outcome. So you can pop that DVD in. It's your cue. You go into your routine, being your wonderful technique and the way that you want to speak, which gives you an outcome, which is your fluent speech, or for today it might be a successful meeting, or it might be a great phone call that you need to make. And there's your outcome. So it's there all the time. You don't have to make an appointment to actually access it. You've got it right in your own lounge room.
We're very, very proud of the whole thing.
And of course, my other motivation is that as a speech pathologist, where we are in particular, to have seen over the years, since 1994 when you and I first met, since 1994, having specifically worked in this area, to have seen the services available shrink for people. Back in 1994, where we are, there used to be week-long programs available. There were weekend boosters available. There were weekly group meetings at the local hospital that people could attend. There was a range of things available. Well, most of those things since 1994, Dave, have actually disappeared.
The Speak Ezy Association is a shining light, though, in terms of support, especially in Queensland, where they offer weekly meetings. And they're very well attended indeed. And the members of Speak Ezy really appreciate belonging to that association.
Because being part of a network or being part of a group or having someone else to talk about creates belief. And you will have great difficulty ever changing any habit or behaviour without belief.
That's right.
And you need that. And it's been proven many times. You get that from other people.
That's right.
That's where your belief comes from.
That's correct.
So we are very proud of the program. We're happy to have it out there for as many people to access as possible, and that's both people who stutter, but the other group of people using it very successfully are speech pathologists in their clinics. They're using it to step people through, people who actually want to do it with a therapist rather than in their own lounge room.
That's right. That's important.
And that's an important option to have as well, so that's available as well.
Thank you.